about your work and the Gaucher organisation?
So I suppose there's probably two sides to the work we do. It's a relatively new incorporated association. I believe it was roughly 2 years ago that was formalised. But there has been a Gaucher association doing work before. It was just not formalised. And as I said, there's two sides to it. The one side is policy advocacy. So that's things like when there's a government review, making sure that there's somebody at the table from the community. When we need to, say, push for one thing or another, that there is an organisation there to do that policy advocacy and involve the patient voice in government discussion. And the second side is the community side of it. So linking patients together, being able to provide resources to people, and sort of being able to share between different Gaucher patients like myself, different experiences. And I know my mum works very closely, especially on the patient side, and she always enjoys being able to share her experiences with people with young children with Gaucher, because that's something that she had to confront very recently. And that's, I think, a very beneficial side of what the association does.
What's your role as president?
So I'm especially involved on the policy advocacy side. So when we have to do submissions to reviews and write letters to government, that's a side that I'm especially keen on. I've gone to meet with ministers and with MPs before to talk about different things. And I think that's very important because, for example, often it's very hard for government to understand the difference between the existing enzyme replacement therapy treatment, which is sort of goes through a cannula in the arm and you've got to go once every 2 weeks, and say the newer tablet oral-based treatment, because on a medical level they may be very similar, but for a patient there's a big difference between having to go to hospital and just taking a tablet every day. So I think involving those patient voices in government discussion and policy making is a lot of what I'm very interested in and what I try to do. But then of course there's just the other work, which is trying to link together the patient community. But I think that's more so of what my mum, the secretary of the organisation, is involved in.
Can you tell me a little bit about your background and how you came to be in the role?
I suppose it started when I was younger. When I was about 14, I ran a national campaign, well, mostly state-based really, around hospital parking fees in New South Wales, because we'd gone to hospital for many years. Sorry, the sort of elevator pitch, I'm very used to giving this elevator pitch for it, is that people like myself that go to hospital very frequently end up paying these hospital parking fees, which were outrageous at the time, something like $30 to park for 2 hours. And you could end up racking up thousands of dollars, and many people did rack up thousands of dollars in fees every year. And I felt that was very unfair, sort of free healthcare system. I ran a state campaign on it. It ended up being quite successful, and we got a big reform with the Premier on a concessions package. So now you could get it very heavily subsidised if you visit regularly, or on a concession card. That got me involved in advocacy generally. It very much imparted the power of the individual in the policy making process, which got me interested in my own condition and the rare disease side, which I find, A, fascinating, but B, very concerning. But so that hospital parking campaign got me involved in advocacy generally, and then I came across the rare disease. I saw some of these sort of issues that were here in my own condition, and it made me believe that the hospital parking campaign made me believe that I could make a difference. And then my own experience with rare disease and seeing what was going on made me believe that there was a need, I suppose, for a organised patient organisation to be in the policy making process and in the community.
Well, what do you think are the particular qualities you need to have to run a successful charity like Gaucher?
I think it's important to have a team of people. people like, especially getting input from doctors and having other people that are enthusiastic about different parts of it. Because at the end of the day, one person is not going to be interested in every single side of an organization. They might be interested, but they're not going to be as, say, qualified or as driven to work in one area or another. So obviously I'm very driven in policy. My mum's very driven in people and working with people and linking people together. So I think for an organization to work, you've got to have a range of people with different skills that are interested in engaging in different parts of it and driving forward the community. And then on the other hand, I think it is important, probably, and maybe an underrated aspect, is to limit the scope. Like an organization that needs to have its goals in the short and medium and long term, and be able to sort of restrict themselves to that. And I think with specific conditions, that can be rather easy, actually, because you can see the things that need to be done or that are very urgent. And then there'll be a lot of issues that are less pressing that you can sort of say, well, maybe we need to have a look at that in the future, but at the moment, these are our priorities. Whereas in maybe a more broad organisation than just a single condition, you'll get a lot of mission creep because the scope's very large.
Are there any particular difficulties that you personally have had to overcome sort of in doing that role?
Well, the hardest part of the organisation was finding the members, because when we started, there's only about 100 people on treatment in Australia, a bit under, I think, but about 100 people on treatment with the condition in Australia. And it was sort of hard to locate lots of them. Many people weren't even aware that the organisation existed, and so that was a very challenging bit. And then as we've grown and done more things, we've now got a sort of base of people that have Gaucher, that are interested in what's happening, and that we can engage with. But I think very much probably the hardest part initially is finding where are your members, where are the people with Gaucher or that rare condition.
So what are the biggest obstacles you see in terms of helping those people access all the support, care, information and treatment that is available to them?
So obviously that first one is that I just mentioned before is very challenging. Finding the people to then let them know that exists.
Right.
I suppose, and then further to that, it's sort of being able to get across the options for support that people actually have. For example, in the Gaucher community, you can have home infusions. Many people might not know that that's even an option. But it is. And so you've got to sort of get across the scope of that, and then when you're talking to individual people, think about what might be helpful to them. But probably the largest, the most significant challenge is being able to reach out to those people in the first place. And then once you can get into a dialogue with them, and then it's sort of easier, and especially with people in similar situations. I suppose specifically, maybe in our organisation, one challenge is that my family, we've got an experience with being diagnosed when I was young with Gaucher, so having to grow through it. Lots of people only get diagnosed when they're sort of older, in their 50s and 60s and 70s. And so without having somebody like that with that experience in the organisation, it can be harder to understand those specific challenges.
With actually trying to find the people with the condition, was there a specific plan or initiative that you did to address that problem?
Yes. So the health regulations were interesting in the area because doctors cannot disclose, obviously, their patients' names or their contact information. That would be illegal. But you can do things such as, if you know that a doctor is treating patients with Gaucher, you can ask them to put out pamphlets for the organisation, or something saying that this organisation exists, are you aware of it, and that sort of thing. So that was sort of the strategy, was to find doctors that are treating people with the condition, and then ask them, could they put out just some information about the organisation. because that is okay, whereas asking them for the information of the patients is not okay. So that was the strategy, was to find Gaucher treating doctors and then to ask them to sort of put out information that there is an association, sort of here's what they do, and here's how you can get in contact.
Is there a particular moment or memory that stands out for you when you really felt that your work was making a difference?
I think in most cases it's sort of been more of a slow burn. We're just slowly getting more members, interacting with more people, putting in submissions to, say, the government review of the condition and its treatments. If there's one moment that I think personally was very impactful, it was probably meeting somebody who has Gaucher, who was roughly the age I was when I was diagnosed. It was like a young little kid.
Yeah.
And I met them at an event because then I was there because of the Gaucher Association, and I think that was very, like, it was very cool because I could sit there and be like, in the next years they could have questions, they could need to know something, and as an organisation we have the lived experience.
How will you know when you've succeeded, I guess, in your role?
I think success, well, there are a few different benchmarks. I think in the medium term, there's a sort of as an association, as people with Gaucher, we have some goals around getting the oral treatment approved for the condition, which would be a big improvement. And it's not yet approved in Australia under the life-saving drug program. So in the medium term, that would be a big success. Other things in the medium term, organising some successful events where we can bring people in the community together. But I don't think there's a sort of a definite end goal. It's not. Lots of associations which are very successful start because their condition doesn't have a treatment, or it does have a treatment but it's not funded here. And in that case, there's a very definite end goal. The end goal is get this treatment funded here by the government, or get the treatment. I suppose as a sort of an organisation for a more matured condition where there is a treatment, the end goal is less definite. It's trying to bring about this sort of gradual improvement in the options available to patients.
What do you think are the most important things for people in the community to know about your organisation?
Well, I'll give two answers to two different communities, I suppose. For people in the Gaucher community, the best thing for them to know would be that the association exists, because that's sort of the biggest struggle that we face. But for the broader community, I think what's important for people in the broader community to know about the Gaucher Association is that as an organisation, we're here to try and give people a better quality of life, whether that be through policy advocacy or through linking people together so that they can sort of learn something from someone who's gone through the same experience. We're here to try and help people to a better quality of life, and especially when it comes to policy, the broader public can be very important in that if you decide you need to run a campaign about something. So I think it's important to keep in mind on the broader public.
Do you want to say anything else?
The intricacies of, I guess, the organisation can be easier to manage because it is such a small community. So you can sort of know all of the stakeholders and you can be across it all. And as long as you keep what you want to do sort of tight and clearer, then you can manage it and it's not too much. And I think as an organisation, we're very fortunate to have a matured condition where what we're working for is to improve quality of life and not necessarily the very hard and big goals like get a whole new treatment and we've never had a treatment before, or try and actually help contribute to the research. But those challenges there are ones that are incredible that are faced by other organisations. I suppose I did have one other thing to say, but I wonder if it's applicable. I mean, look, I was thinking about this the other day. It sort of about advocacy in the rare disease community specifically, which is that in countries like the United States, there are all these rare conditions like my one, where they have patient organisations with thousands of members, because it's just such an enormous country. And then you've got countries like New Zealand, small country, so you can have rare disease organisations where they've only got like 8 people that even have the condition in the entire country, which makes it almost impossible to advocate effectively, because maybe none of those 8 people are interested in it. And then I think Australia sits in this middle place where there's a significant population, but it's still a small one. So you're sort of rolling a die to see, is there going to be enough people in the community that are really interested in trying to push forward some advocacy? I mean, we're a member of the international sort of organisation for organisations. It's called the International Gaucher Association.
Okay, right.
Or something along International Gaucher Organisation, perhaps. But so, and we get some very interesting insights by speaking to people within, such as the British Association for people with Gaucher, and that is actually very helpful. And you can see how much more sort of resources they have. There's a bigger country with like 3 times the membership, and it's just, when you have a big enough population base, when you roll the die, you're probably going to get somebody who's very driven and wants to advocate for the community. And when you get a smaller patient base, that can be a lot more challenging because there's just less people with the condition. So I think in Australia, the question is sort of, for conditions with about 100 people that have it, how do you get effective advocacy? And it's mostly tends to be personality based. I've met some people at events, they can have a condition that only has 10 people, but because they themselves are personally so driven, that condition might get better advocacy than a condition with 100 people where there's just nobody in that community that is really interested in advocacy. So it ends up being so chance and personality-based advocacy in these small conditions in small countries.